Hello, everyone. My name is Othman Othman, and today I'll be talking to you about brucellosis in Saudi Arabia. First off, what is brucellosis? Brucellosis is one of the most common zoonotic diseases in the world, affecting both humans and animals. It is caused by the Brucella species of bacteria and is also known as Malta fever or Mediterranean fever. It affects both developed and developing countries. However, it does affect developing countries more commonly, especially the Mediterranean, the Arab Peninsula, and India. There are over 500,000 new cases of brucellosis every year, and left untreated, brucellosis infection can lead to arthritis, endocarditis, and in rare cases, death. So how is it transmitted? Brucellosis can be transmitted directly or indirectly. The most common method of transmission is through the consumption of unpasteurized dairy products from infected animals or consuming undercooked meat of infected animals. However, direct transmission involves exposure to urine and other bodily fluids or close contact with infected animals or their carcasses. So who are the carriers of brucellosis? So the most common carriers of disease are cattle, sheep, goats, camels, pigs, and dogs. In Saudi Arabia, the cattle and camels are considered the most common carriers of disease. So who's at risk? Saudi Arabia has the highest incidence of brucellosis infections in the Middle East. That is due to their high import of cattle and camel products and meat. Men are also at a higher risk due to their occupations, and farmers are also at higher risk due to their proximity to animals for their jobs. Other occupations such as butchers and pet shop workers are also at a higher risk. Another major at-risk group are the Bedouins or nomads in Saudi Arabia due to their cultural behaviors. That is because they consume camel meat and dairy products and also have a limited access to healthcare. So how do you know if you have brucellosis? So these are the most common symptoms of brucellosis, and it can also be misdiagnosed. So high fever, muscle and joint pain, headaches, sweating, including night sweats, abdominal pain, nausea, anorexia, or sudden weight loss. So if you have any of these symptoms, it's better to be safe than sorry. Seek medical help. Like we said, if brucellosis infection is left untreated, it can cause complications such as arthritis, meningitis, endocarditis, which is the most common cause of death by brucellosis infection, swelling and inflammation of the liver and spleens, and neurologic symptoms such as seizures or loss of motor and sensory functions. So how do we prevent transmission? So fortunately, brucellosis infection can easily be transmission can be easily prevented by avoiding contact with infected animals, proper washing and sanitization of food, ensuring that dairy products are properly pasteurized or that meat is cooked properly. However, organizations and the government can also increase prevention of spread by increasing awareness of brucellosis transmission and symptoms, ensuring that the farm animals are properly tested at regular intervals, increasing regulations on imported animals, and enforcing mandatory vaccinations of common carriers of disease. So brucellosis can be diagnosed by a simple blood test sample or a urine sample. It can also be diagnosed by observing changes in the body using X-rays and MRIs, such as changes in the joints or inflammations in the tissues. Brucellosis can also be easily treated using a number of antibiotics. However, there is a 5 to 10% chance of relapse. So these are my references, and thank you for attending.